This is a press release from the Care Quality Commission relating to Northumberland County Council's performance in relation to adult social care. It is read by an AI avatar for Hexham TV and is dated 24th of January 2025. It begins, the Care Quality Commission, CQC, has rated Northumberland County Council as good in how well they are meeting their responsibilities to ensure people have access to adult social care and support. The CQC has a new responsibility to assess how local authorities meet their duties under Part 1 of the Care Act. The CQC looked at 9 areas spread across 4 themes to assess how well the authority is meeting their responsibilities in order to create their good rating. CQC has given each of these 9 areas a score out of 4, with 1 being the evidence shows significant shortfalls, and 4 showing an exceptional standard. Firstly, how the local authority works with people. For assessing people's needs, they scored 2. For supporting people to lead healthier lives, they scored 3. For equity and experience and outcomes, they scored 2. Next, for providing support. For care provision, integration and continuity of care, they scored 3. For partnership and communities, they scored 3. Next, how the local authority ensures safety in the system. For safe pathways, systems and transitions, they scored 3. For safeguarding, they scored 3. Next, leadership. For governance, management and sustainability, they scored 3. For earning, improvement and innovation, they scored 3. James Bullion, CQC's Chief Inspector of Adult Social Care and Integrated Care, said, "At our assessment of Northumberland County Council, we found an organisation putting collaboration with people and partners at the heart of everything they did. This was having a positive impact on people's experiences, which we saw reflected in the feedback people gave to us on their interactions with the authority. This is particularly impressive given the logistics of providing support to people in rural communities over such a vast geographical area. We saw that people using services received up-to-date assessments and reviews. It was also good to see the way the local authority worked with people to put clear goals in place, and that assessments reflected changes in individual needs. This was mirrored in the impressive data that showed over 95% of people had reviews during a year, compared to the England average of under 60%. This was reflected in the amount of people feeling in control of their daily lives being higher than the national average. People who needed care after being discharged from hospital had a good experience. Over 90% of people aged 65 plus were still at home 91 days after discharge from hospital into reablement and rehabilitation services. This was higher than the England average of 83.7%. Staff were very rightly proud of their work supporting people to remain in their own home. Northumberland built strong and meaningful relationships with partner organisations, including the voluntary and community sectors. This positively impacted people's experiences and outcomes, including preventing delays in their care. They aim to involve partners on decision-making, commissioning, and delivering services. We heard about the joined-up approach between health and social care, with good communication between different teams, meaning people didn't need to repeat their stories and experiences multiple times. The multi-agency safeguarding hub had been recognised regionally and nationally by His Majesty's Inspectorate of Constabulary and Fire and Rescue Services as best practice for its management of high level of risk and harm to children and adults at risk within Northumberland. However, the authority needed to improve its understanding of the needs of different groups to ensure that people receive the specialist care they need. For example, we heard from people with learning disabilities who had challenges integrating into their local community and accessing employment opportunities due to transport links and a lack of specialist support. However, tackling inequalities was a key priority of Northumberland's strategic ambitions with aims to further develop its work. Overall, Northumberland should be pleased with the findings of this assessment and the good practice we found. The full report can be found on the CQC website.